Dr. Tieche and James Calloway, our guests for today. James is a good friend of ours, and he's an RVT in the Central Florida area. What is RVT?
Registered Vascular Technologist.
Okay. Sounds important.
It sounds pretty impressive.
He is. He's an important guy. He also does a little bit of help at the Recharge Clinic with us. But so we're going to start out talking about weight loss today, and then we have some fun topics to talk about. A couple that I don't know about that Dr. Tieche wouldn't tell me he was going to bring up today.
Yep.
Surprise. But I have got some good ones too. Okay. I don't know if we'll get to all of them, but we'll try.
Probably won't. We never do.
So, I have a good weight loss tip for nighttime snacking. Like, what stops you from nighttime snacking? Is brushing your teeth after dinner, right? If you brush your teeth, maybe that'll stop you from eating? No?
No.
Okay, they both look at me
way.
like, that's not stopping me.
Yeah, not me either. I mean, it may be a little deterrent for about 15 minutes, and then after that, it's game on.
Huh.
Yeah.
Well,
It's a good idea. I mean, I think if you... Yeah, it could work, but it doesn't work for me.
well, it works for me. I mean, because I have to put a retainer in, so if I put my retainer in, I don't want to...
And you go out like a log and you sleep like you're in a coma all night. So that's probably another reason.
I do. I'm a good sleeper. It's not a
I think a full
problem.
glass of water helps too.
I guess. Then you got to get up
You get a
and
little bit of feeling.
you got to get up and pee a lot. Yeah,
You're getting up all night peeing anyway.
I do. That's because I'm old, as you so point.
But that water is my next tip, is drinking water before you eat. Like, if you feel like you're starving, drink some water, and I think you'll eat a little bit less that way. That way you're not just,
So I have another water, not a water tip, but this is a water controversy that I've battled with Cynthia on a lot. So
Is this what you didn't want to tell me?
Yeah.
I knew it. I knew that this was what you were going to say.
Okay.
I know it's about water and what you can put in it, right?
Nope.
Oh, what?
Can I finish?
Maybe.
So
Go
anyway,
ahead.
really what it's about is I work out, she works out. I never bring water. I hate to bring water when I work out and drink. And when I'm there, there's people that are, carrying bottles of water. There are people carrying gallons of water, jugging them down, And so my question is there a difference? Is there a difference drinking water when you work out or not?
A difference in what?
In how you feel, or is it one better or not? And do you need to?
Okay.
Do you need to?
Well, is there a difference in how you feel and do you need to? Two different things. I think you should. Why not? You're sweating a lot, hopefully, if you're working out. And how you feel, for sure. Because if I did forget my water, maybe it's just because I am such a water drinker, I don't know. But I don't feel as good. I feel a little more worn out. When I can take a sip of cold water, it rejuvenates me in my workout, and I can go a little bit better.
So that's one of the characteristics, which is... So one of the variables, there were several studies done on this, and one of them...
Of course, you would go...
And find out.
Because this is an argument we have.
Yeah. So it really depends on your hydration pattern. So she's somebody who likes to have a lot of moisture in her mouth and drinks a lot. So that's really what it is. More than a physiological thing of getting volume depleted and feeling like you need it. So it's more just a sensation that she needs it. Where people who don't drink a lot of water don't have that sensation, such as me. I drink, but I don't have that moisture in my mouth all the time. So
just
that's
talking about water makes me thirsty.
Yeah,
I'm thirsty right now.
So typically, the answer that they came up with, it depends on a couple things. One is the duration of workouts. Any workout over 2 hours, an hour to 2 hours, definitely you should have water. But any workout less than that, no, you're just You're probably not sweating enough or getting dehydrated enough to need it. Now, that's just a matter of convenience or just personal preference at that point, but you don't really need it. And so, because people have always made me feel like I'm doing something wrong, I'm not going to have a good workout if I don't drink water or lug around a big jug of water and chug it every 2 seconds. So, and I always think it's ridiculous.
This is what I have to deal with. If we have any argument, he's got to do all this research.
So how do you know? So one of the things they say is, if you are going to have one of these dehydration type workouts where you're going to sweat a lot, like, a lot of maybe spin or maybe Zumba classes or something like that, to drink water before, kind of prehydrate, but go the whole time like a normal adult without having a sippy cup.
Oh, geez.
Without having a sippy cup to drink water on, and then wait till you're done. Now, depending on how hydrated you were before, in other words, had you been normally hydrated and urinating a normal amount and your urine's clear, then you're fine. If you're dehydrated before, then all bets are off. Where you haven't been urinating a lot and it's very concentrated, then you probably have to drink during this like a little baby. But anyway, I feel as though an adult could make it an hour without drinking, and I do. So I don't. I don't feel any different after my workouts.
Well, why don't you try drinking water in your next workout?
No,
Maybe you'll feel even better and get a better workout.
I have tried. I can't stand carrying that bottle of water around.
That's what this is about.
It's all about that. It's all about that. But it's not that. I mean, if honestly I felt dramatically worse, of course I would do it. But I don't feel any worse. People want to say, "Where's your water?" And it's just a time wasting thing. Oh, I gotta have my little sip of water. So now I can work out again.
Oh my gosh.
It's got nothing to do with that
crazy.
water.
Yeah.
I'm zeroed in. So it's not that water that goes, oh, now I did a rub because I had a sip of water.
The argument's over.
Argument's over.
And how long does it take from the point at which you drink water to actually get into your bloodstream?
Very quickly. Water's absorbed really quickly. Okay. Particularly room temperature water. So, anyway.
So I can't say anymore, bring your water.
You can say it, but now we know that myth has been dispelled.
Oh, God.
For my type workouts.
Yeah.
So look at runners. I mean, runners don't drink. You know, they run for 2 hours and maybe take a sip of water, but they're not drinking the whole time. And, you know, they're out sweating. And people that are, you know, bicycling or mountain biking, they're not drinking the whole time. So it's, you know, I think it's just a matter of, you know, I think what it's part of the workout gear. I'm going to bring a towel. I'm going to bring a jug of water.
Gosh.
So now I'm really working out. That's what I think. Anyway,
so you're doing it just to spite. You just don't want to drink water in spite.
Yes.
Everyone.
Yeah, I'd rather just drink coffee.
Oh gosh, please.
So along those lines, interestingly, you know, I like to bring up, you know, different stuff. So just so you know, like men are made up of about 60% water, and women are made up of 50% water. So where I'm going with this is, I like to talk about some interesting cases that we have or interesting patients. So we had a patient, you know, some time ago who came in who really didn't have a lot of complaints about her weight, but had just complaints about fatigue, but that she had been to another clinic and was told that she was retaining fluid and had X percentage of body water, and it was really excessive. And they just told her like she had a problem. They did some impedance test and say, well, you're retaining a lot of water. And it made it, and she's like, well, what do I do? Well, you know, you have to detox and you have to do through a cleansing regimen and drink more water, so that'll help you get rid of water. And so when she came into me, her first complaint was, I said, well, how are you doing? She goes, I don't know, I'm just retaining a lot of water. And I said, are you swollen? Are you swelling? Are your legs swelling? Are you having trouble breathing? I mean, any kind of thing that would, you know, you're feeling puffy? Do you look? No, that's just what I was told. So this lady was petrified that she had something wrong with her and she was retaining water, whatever that meant by their terms, but really didn't have any of the classic symptoms of retaining water. Now, James is an expert on swelling and leg swelling and fluid retention because of both doing cardiac studies, but also vein studies, right? So people who have excess fluids typically have swelling, right? Or we call edema.
Yes.
And they would have leg edema, or if it's generalized, it would be all over their body. That's called anasarca. So she didn't have anything like that. But someone just came up with this thing because of their diet regimen. She wasn't losing any weight, so they just tried to
So they couldn't help her lose weight, so they
on
told
her and said, basically, you're retaining fluid.
That
And I
was
said,
it.
well, what was their solution? They didn't have one. They just kept telling me, and every time they would look at me like it was a really serious problem. I said, did they give you a water pill then? I mean, if you had so much water, why didn't they give you a diuretic? Well, they didn't. Anyway, so I just thought that's really where all of this water stuff ties in. She has other stuff, and we're working on it, and I think she's going to on her road to getting fixed. But I felt bad for her because she had this implanted in her head that there was something wrong with her based on this water thing that was really kind of a nebulous statement. You have this water problem. It's like
asymptomatic water retention.
Asymptomatic water retention, which doesn't make any sense. You know, if she peed normal amount, I mean, everything was pretty much normal. It didn't even make any sense. It's just like
it was just
saying,
their excuse
just a
to
saying.
give her.
Yeah, it was a crazy statement. Anyway,
it does sound like it.
yeah. So, yep.
So, you know, we believe in a keto diet. But what about people who don't eat meat, Doc? What do you recommend?
So really, with that's one of the things that, for keto or low glycemic diets, what is the main? How are you going to get your protein? That's really the question. There is not how you're going to get your vegetables because they're DITA. It depends on their level of really vegetarianism or whatever you want to call it. So if they are, eating dairy and eggs, there's a subset that, so there's the set of people who eat no meat, there's a speed of just eat fish, then there's some that eat dairy and eat cheese and eggs and milk and fish, and so there's all little versions of this. So that's really the first thing that you have to define is what protein consumption will they have. So if they are eating eggs and fish and dairy, that's pretty easy because that's a lot of options there. You can eat a lot of different egg type things with cheese, and you're going to get a lot of your protein. And you can get whey protein. The powdered protein is whey. That's milk based, and so there's nothing wrong with that. Even vegetarians will drink that, pure vegetarians, and that's an excellent source of protein. So that for those, that's that. The people that are eating fish, well, if they're in that's the same thing. So it's really the people who are not going to eat any of that. They're just purely vegetarians. So those are the ones where you have to try and either get them to eat more soy, soy curd, and things like that have protein. Now, we typically don't want people to eat a lot of beans on that low glycemic diet because they have a lot of carbs. They do have a lot of proteins. So sometimes you have to make that little swap off for that. But the same thing is, will they eat protein bars, that don't have any kind of meat associated with them? Because now there really are a lot of those things. 10 years ago, probably not so much. 20 years ago, it didn't exist. Now, because of all the varying, gluten-free, non-GMO, all of the kinds of things that people are out there with these really specific diets, there are a lot of protein options out there that you can have without having meat-based thing, if that's really what is bothering you. And I know that most of the protein bars that I eat don't have anything like that. I mean, they have whey protein is the biggest source there. So it really is going to depend on that, if they're going to do that.
Well, I think it's important that vegetarians pay attention to their protein intake, because a lot of times they're just like, yeah, I'm vegetarian, but they're paying no attention
Correct.
to anything.
Well,
and they're just eating crap.
There's another whole other side of that. So there's true vegetarians. It really depends on the person. So there are true vegetarians who are eating basically, salads, whole vegetables, prepared how anyway, even adding their beans and maybe some brown rice and stuff like that. In my mind, that's what I think of as a true vegetarian. But there are really carbitarians, who are people who are eating mostly bread and crackers and potatoes and things like that are not eating any meat, but they're eating just super high concentrated carb foods. And they're like saying, well, I'm a vegetarian because I don't eat that. Well, they are not the same nutritionally at all. One is going to promote fat gain and one is not.
All right, so we will come back after the break. Cynthia Tieche here with Dr. Tieche and James, our guest for today. James, tell us a little bit more about what you do.
I use ultrasound as an RVT to diagnose any vascular disease, that's anything within the arteries or veins. And I also provide surgical assistance with the venous ablations and a new procedure called VenaSeal, down problematic veins that are allowing venous reflux in the legs. So I get to scrub in with.
So you give people sexy legs.
Sexy legs.
Get your sexy back.
So ultrasound, does ultrasound hurt?
No, completely not. It's safe. It's non-invasive. It can be repeated. It's
So it's not. It doesn't have
very
any.
much.
Yeah, it doesn't have any like X-ray exposure.
No, none at all.
So it's based in sound waves, right?
Exactly. That's how we can ultrasound babies as much as needed. There's no cavitation. Not enough. The cavitation is so level we don't even have to talk about it. It's yes, it's completely safe and painless.
Mm-hmm.
Cool. Very cool.
Yeah, I get to travel around a lot, be at different offices and work with different docs, and that's it. We get to help people get rid of their ulcers. They've had some patients with their primary cares haven't properly identified venous insufficiency, and I've had ulcers for 2 or 3 years. Some people have legs that weep fluid because it's just the pressure in there is so tight, and they just exhausted. They don't know what to do, and they finally make it to a qualified physician that can identify it. And with proper treatment, the pressure comes down. They regain a lot of mobility. I had one patient say he didn't think he would be able to take a trip with his son to New York and ever be able to do that again. And after the round of treatments, he wrote me a big long letter saying he was able to walk around all day at Times Square.
Wow.
Up and down stairs. And
So it's not just an aesthetic thing. It's actually their legs are in pain, right?
Some people just want their spider veins taken care of, or little things they see on the surface.
Move closer to the mic.
Little things they see on the surface, but yeah, a lot of it is truly medically beneficial.
Well, and that goes back. When I was doing veins all the time, the big problem is lack of recognition by most providers. So vein problems are way more common than arterial problems. Arterial problems have much more publicity, peripheral vascular disease and all of this kind of stuff. But veins are much more common. I mean, it's, I don't know, it's like 40 million people have vein issues. So typically a vein problem is leg swelling, leg heaviness, restless legs, leg fatigue, prominent veins in your legs, redness down in the lower part of your legs. Everyone has seen people with this. You walk through the stores and you'll see someone with, swollen legs, red legs, and that's kind of more of an advanced thing. But when you just have uncomfortable legs or your legs hurt at the end of the day, you're like, oh my God, my legs kill me. That's a sign that you have a vein problem, and that's something that you should bring up, to your PCP. I mean, so that you can get an evaluation. The evaluations are simple. They're painless. It's an ultrasound. They scan your legs with this, sound wave thing after they put a little bit of gel on it, and we can see the veins, see how well they're functioning.
So who should they go to? Because we know that people have had bad experiences with people.
So
I mean,
really,
just not their primary care, or
no, well, you may have to go to your primary care to get a referral, but you may not. But you can just seek out a vein care center. Certainly you'd want one that's accredited if you could find that, and find people who specialize in it, because there's a lot of people, like everything else in medicine, who dabble in things. They went to a course and now they think they're vein experts, and so they really don't have a good understanding of what's causing the problem and really how to treat the problems that may arise afterwards, because it's not always straightforward. Many times it is. Someone gets a treatment, their legs are better. But what happens when it doesn't? And that's what you want, someone who's an expert in that area, how can handle other problems that are associated with veins, because there's a lot. So
I agree.
yeah. So do your research. Go to the right person.
Mm-hmm.
So I have a topic today that I want to bring up. I want to talk about vaginas.
Okay,
Yeah?
bring it.
Can we talk about that? Do you guys know much about vaginas?
I know that I don't get to see them enough.
Wow.
Well, you
Okay.
You opened that can of worms. How about you, James?
That is not even the way that I wanted to talk about them, though.
Well, you said, do you know anything about it, or what do you think about
Well,
them?
we talk about if you have an eye infection. We talk about if something's wrong with your ear or your skin. So why can't we talk about vaginas?
We absolutely should.
But the problem is that there's a generation that was not allowed to talk about them, right? Don't talk about your period. Don't talk about anything. And they had kids, and I think women are getting better about talking about them. But I know me having daughters, and we talk about periods and everything openly. But a lot of their friends, it's like taboo. You can't even mention it, and it's kind of crazy. But So that's like the younger ages when you have a vagina. But when you get older, it's a little bit of an issue, and that generation is still really afraid to talk about having issues. And you can actually have some problems that can easily be solved if you talk to your doctor, but they're afraid to talk to them. And maybe some doctors don't understand all of the issues, but what are some issues that someone could have when they get, and not just sexual dysfunction, that's a huge issue, but what other issues could you have that you need to talk about?
Well, one of the most common ones that I see is when people, as they start getting a little older and their hormones change and they go through menopause, one of the things that happens is their estrogen starts to go down. And basically, estrogen is one of the hormones that both men and women have. You know, some of the functions are it helps your skin, it helps your joints. But for women, it provides lubrication, and that's vaginal lubrication. And so what happens is there is a huge set of women who have vaginal dryness, and it sounds like that's not a big deal, but
Because you think about vaginal dryness just during sex, vaginal dryness,
Right.
but it's more than that.
right. So we're not talking about, and so for guys, it's a little bit difficult of a concept to understand because we don't really understand what's wet and dry and all of that. I mean, when you say wet, you know, you think it's, you know, like a pool wet or dry like a dry towel, but you know, but when you talk to women, it is extremely uncomfortable. It is uncomfortable. Their legs rubbing together, it's so dry that legs rubbing together hurt. Putting on underwear hurt. You could not ride a bike. You don't really want to sit down because it's that
Wow.
uncomfortable. And so, you know, that's an awkward thing for people to talk about. And so what happens a lot if they bring it up to their primary or bring it up to their GYN, sometimes they'll be put on estrogen replacement. And a lot of times what I see is they put on a token dose. In other words, here's your dose, shut up, go away. And some get complete results, but some get none. And they're kind of afraid to go back and talk about it.
It's
So they just
embarrassing.
So they just kind of suffer with it and think that, okay, this is just my lot in life. But when you talk to them, it's very debilitating. It has a big negative impact on their life. And because, you know, I mean, if someone's underwear hurt, that's pretty bad.
Yeah,
And
that's
so,
terrible.
So typically that causes everything. I mean, they're more prone to infections. They're more prone to urinary tract infections. Certainly, dyspareunia is pain during sex, and that tissue just breaks down more because it is dry. It's like chapped lips.
What causes that?
Lack of hormone.
So the
estrogen.
fixing it would be hormone replacement
Yeah,
then.
absolutely. I mean, there are some people who after that still have it, but very rarely. It's very easily fixed
They're
by
just-
either, you know, I mean, there's.
Why does hormones fix that? Like what are
Because
they doing?
it re-stimulates everything. What happens is that hormone has stimulated that whole area, those glands, to produce a normal amount of lubrication, like a sweat gland or a salivary gland. There's that lubrication there. When that hormone is taken away, those things just shut down. They are not being stimulated or told to produce anything, so nothing happens. So when you give back even a small amount, things start to come back to life again, and you know, it can be applied vaginally, intravaginally, topically, through pellets. There's a lot of ways of applying it to get that desired level.
So who can they go to with this problem? That's the problem.
Well, that's right. I would like to believe that this is a common problem, so primary care doctors should be able to take care of it, but I feel that most of them are very uncomfortable with that. And so they are typically the ones that are going to really underdose, maybe give them a small dose of estrogen patch or estrogen tablets, and let them be on their way. Secondarily, then many women go to gynecologists for their annual exams. That should be another one, but sometimes that's not treated as aggressively, or it's taken as seriously as other problems. I mean, you know, someone has cancer or this kind of things. Yeah, those are real things, but debilitating problems affect more people. And so it's more of a quality of life thing. You know,
Right.
Yes, you're living, and yes, you're not dying of that, but your quality of life is not improved. So it's almost just as bad for many of these people. So really, people who specialize in hormone replacement and have an interest in trying to fix that problem.
So
Because it's not always just a straightforward, easy fix. Sometimes it requires
and a couple treatments. and someone
and
just
maybe
put on there.
and dosage adjustments, because it's not, you know, it's like everything. It's not just one size fits all. You know, you try it and then you reevaluate and try and evaluate, and you may have to totally switch gears and try something else.
So it's like we talked a few weeks ago about going to a medical doctor who has experience and education and knowledge in this, and someone who has a good office team as well to follow up, and because it's not just a one-time here, done, you're good to go. I mean, it may take a few times to get it right, and get them feeling their absolute best. So don't be frustrated. If you have any of these issues, don't be embarrassed. If your primary care physician or whoever isn't willing to take care of it, come see Dr. Tieche, because he will, and he does have experience in this, and he can help. And it's nothing, it should not be a taboo subject. People should be able to talk about it. I don't understand. Everyone came from a vagina, and all women have vaginas, so why can't we talk about them?
Well, I mean, and I agree. You know, really the same thing when men come in. You know, initially when men come in, they're very nervous about talking about, you know, erectile problems or any kind of sex problems. But I try to make it basically just an open topic, you know, and talk about it just very frankly, because I don't want it to be something like, okay, we're going to close the door and we're going to whisper when we talk about this and, you know, make people feel uncomfortable, because it's so common that, you know, people inherently don't want to talk about it and they just want to live with their kind of problem, but it affects their lives a lot.
It affects their marriage.
Their marriage.
That's going to be a big problem if you don't get that taken care of. And at some point in your life, you're most likely going to have one of these issues, right? A lot of people.
A lot of people do, yeah.
So it's common. You don't have to be embarrassed about it, but you should fix it and get feeling your best, right? Well, I'm getting some comments that they love this subject that we're talking about.
Okay.
Yeah. But someone did say that their last pellet they got was the best thing for that and really has helped her a lot. And anyway, someone commented and said that you blushed, James.
Did I?
Yeah, I don't know.
Guilty, probably. I can feel it.
Anything else on that?
I don't.
No, I think that it's, you know,
You might feel.
Yeah, I think estrogen replacement for many women helps a lot of things. It's not just the dryness. You know, some of that tissue, what we call atrophies, kind of shrivels up a little bit, makes it more, you know, the word is friable, makes it more easy to tear. And so what happens is when some of that happens, the angle of the urethra, where you urinate from, changes. So women start having more urinary tract infections. They start having more incontinence, things like that, from just lack of hormone stimulation. Just as though men, of lack of testosterone, your muscles kind of get weaker, motivation goes away. It's just a lack of that. If you don't give a plant water, it kind of shrivels up, or if you don't give it the proper vitamins or nutrients, it does. So these things are all normal because they weren't before, and then they happen. So, you know, it's not like it's really difficult to understand. You know, probably a 20-year-old doesn't have this problem, but you know, someone who's postmenopausal does. Okay, what's different? Really simple.
Hormones.
Yep.
Cool.
What you got?
So really, changing over to something else, totally
Probably
different
not as fun as my
thing.
topic.
It is not even as close as talking about vaginas. So, you know, in my, you know, we're always talking about nutrients and how to stay healthy with all these different kinds of things, exercise and stuff. But there's really like three basic premises that we all have to kind of look at within our own little microcosm. And that's really clean air, clean water, and clean food. And so what does that really mean? You know, because it's kind of vague. It's like, well, of course I have clean air. Well, actually, most of us don't really have clean air. So the thing is, you have to think about, we spend 90% of our time, most adults spend 90% of our time indoors. And so we're in an area that's confined, that may or may not have good airflow and good air circulation. And we could be exposed to a lot of stuff while we're in there. So what kinds of things are we exposed to in our houses? Well, there's all kinds of dust in our air, and if we have pets, we have those kind of things too. But one of the most common things, and I talk about this all the time, is I'm a big proponent of dehumidifiers. And the reason being is one of the most common contaminants that we get exposed to are mold. There's all different types of mold spores. And mold spores start generating and at a humidity of greater than 50%. Well, that's pretty much continuously here in Florida. And so what that means is these things are not just forming mold everywhere in your showers, green and, you know, black mold everywhere, although it will go to that. But in certain high-risk areas like bathrooms and kitchens and places where there might be moisture accumulation around your air conditionings, that is increasing, and it allows these molds to replicate and become airborne. That in itself causes allergies, sinus infections, fatigue, cough, all kinds of stuff like that, and increases dust mites. So, the thing is, that's one of the things that we want to try and control with our air is, one, we want to have an air filter, and like a HEPA filter type thing. People think that they have their air conditioning on and it is filtering, but it's technically not really filtering to the same extent as an air filter you would have in your room. It's filtering while the air is on, but the air is not on continuously, and those filters are not that small. We want air filters that have very small pores in them, so a lot of things get trapped. So kind of getting off of the dehumidifying thing, which is kind of getting that moisture level down to get rid of molds and those type of things, you should probably have them near your bathroom, near your laundry room, and things like that to kind of lower that. And one would be amazed how much moisture is taken out of the air with that.
I know you're amazed all the time.
I am amazed every day. I always talk about it, and she gets mad.
Well,
I'm like, look at how much water comes out of here.
Every day he goes to empty the dehumidifier, and he's like, look at how much water was in here. And then the next day, and I'm like, I know. It's a lot of water.
It is.
But it is really crazy how much water comes out of that
thing. Twice a day.
Twice a day. And how big is that? A gallon, 2 gallons?
Two gallons. And so
Sucked
that's
up
just
from
in our
our
bathroom.
bathroom.
Yeah. And so that's
Crazy.
just what's there, and I have it set on 50%. It's not like it's down any lower than that. But so back to the air filters and going back into an air filter of trying to cut down on exposures that cause us to feel bad. So, sinus infections are rampant in most people in Florida for sure. Fatigue, coughs, all of that kind of stuff. So we want to limit the things that are actually in our air. And like I said, we spend most of our time in our house. So these air filters help get things out. So some of the other things that are in the air that cause us to feel bad, and this is really common everywhere. I mean, you're not going to see is what are called VOCs, volatile organic compounds, and those things are kind of in paints. One of the most common places that they are also are is air fresheners, and almost everyone has air fresheners in their house, and candles, things like that. And so these things add to nasal irritation. They cause cough. They can cause fatigue, and some of them with high enough exposure can cause cancer. Some of the other things that we're exposed to in our house that we don't even pay attention to is pesticides. Many people are having their houses sprayed because we have an ongoing bug problem in Florida all the time. And so we are that is concentrated in our air that we're sitting there breathing. We try to limit our exposures to pesticides, but yet we're inviting it in our house. And that way, I don't know a good way around it. I mean, I know there's kind of organic things to kill bugs, but so it's just something to consider, maybe having more air filter there.
What can you do at work? I mean, if you're in an office, you're probably in that office all day too. So what can we do there?
I think you need air filters. I mean, I think you need HEPA filters and things like that.
HEPA filters.
Yeah.
Okay.
And so there are some that do, take will circulate a whole large area, and then there's some that will just do a smaller area, and so there's ways of doing that. Other thing, carbon monoxide. That's another thing that we have to worry about. Carbon monoxide typically is, we have to worry about if people have gas stoves or wood burning, things like that. That's a byproduct of that, and it's very indolent. So that's one of the things that we know is made in cars when people are sitting in their car in their garage and maybe reading or something. I don't know what they could be doing. You'd have to sit in there a long time, but anyway, you can get exposed to that. But if you have a leak in your house, that could be a problem. One thing that I was going to mention is secondhand smoke, but if you're a smoker, that's just it. But other people who are getting secondhand smoke, that's a big pollutant if you're not a smoker, and people are smoking in your house. So
What about, I got some questions on that. What about secondhand vaping? Is that anything, or is that pretty safe?
Not much.
Okay.
Because it's really just a mist.
And then what about candles, or is that on your list?
It's on the list.
Yeah.
So then there's radon is another thing that we need to kind of worry about in cleaning our air. So radon really comes from the ground. And so a lot of people have had radon tests when they bought their house, but it's something that's in the rock and stuff down below, and that seeps through the slab or whatever you want to call that thing. I can't think of it. Anyway, and we get exposed to that. So let me see, I had some more stuff I wanted to talk about, volatile organic things, but let me go to the other thing. So that was the air, water, clean water. So, everyone just assumes by drinking bottled water that they're doing well. Well, of course, this is probably one of the worst things that we should be drinking out of, because a couple things. One, most of these bottle things are made out of have a residue in it that's called BPA, and that was kind of found to be a little bit toxic to people as well as hormone suppressive. So what's happened is there'll be a lot of water bottles that are produced now, and they say BPA free. But what the plastic companies have done in their mischievous way, they came up with a variant of BPA, and it's like BPP or B or something. But anyway, it's a variant, but it's not BPA.
So they're saying no BPA
We
in
have
here,
no BPA in
but
there,
they're putting the other
but they're
in?
putting another chemical in there. So it's kind of BS, really.
Great.
But not only that, there's still even other chemicals that are being leached out of plastic water bottles. I know it's inevitable. There's really no way that we can get around it, but I think to limit it as much as you can. So if you're someone who drinks a lot of water all day, instead of getting a new bottle every day or filling the same one up, try to go to stainless steel, go to a ceramic glass or just glass and drink out of that. And then there's the thought, which is better, bottled water, tap water? Honestly, the studies show that actually tap water is most of the time better than most bottled water, because most bottled water is only just filtered tap water. It's not coming from a spring. There's very few true spring waters that are coming. All they're doing is just putting a little filter on it, like you can at in your house on your refrigerator, and they're pumping it out and charging you, jillions of dollars, really, when you think about the markup on that. So most places, their tap water, and even most cities, their tap water is very safe to drink. So going to a restaurant and getting tap water is probably better for you than getting bottled water, which is kind of an interesting fact. So then there's food, because we want to have clean air, clean water, and clean food. So clean food really is more than just eating organic stuff, or it is trying to eat organic, but really what are the exposures, the main exposures when you look at food? Well, there's a couple things. There's chemical exposure, there's physical exposure, and there's infectious exposure. So chemical exposure really is pesticides and things like that are applied to the foods. So that's,
we will come back to that. We'll be back after the break. Cynthia Tieche here with Dr. Tieche and James. We were just discussing how to stay clean, I guess. Not drugs.
I think we're on the food.
We're on
Yeah.
food. I was
With
talking about some of the
air
exposures
and
with your foods. We're talking about clean air, clean water, clean food.
Clean
So the
food.
things that you have to worry about with your food. So I was saying, some of the exposures from food are chemical exposures, whether they had pesticides and things like that. This is why you have to be really pretty compulsive about washing your food, because really, there's this big push to eat more raw food, more raw vegetables. So you have to take some of this stuff into your own hands as far as cleaning this stuff. So the other thing was, so there's chemical exposures, physical and infectious. So physical, I thought, what the heck physical exposure could there be on food? Well, it turns out they did some studies on some foods that was, produce and stuff like that, and the array of stuff that they found is fairly disgusting.
Oh God!
I mean, it's little pieces of plastic that were maybe in the manufacturing or the packaging process, to fingernails, feces, all kinds of stuff that is in there, all over the food, even though it seems that way. So anyway, what I'm just really getting with that is, be careful, wash your food. That's it. That's really the best way to do it.
What should we be washing it with?
Well, there are some mild soaps you can wash it with. You know, really the biggest
For
thing,
vegetables.
yeah, but the biggest thing is really rinsing it with water and putting a little friction and stuff on it is best.
And you're referring to vegetables, right? Not like fresh meat. I mean,
Well,
obviously
meat,
you wouldn't wash
hopefully
that with
you're
soap,
gonna
but okay.
Yeah, meat does
And
have that. So some of
So
that
you want to
meat
rinse
does-
that off too, right?
Yeah. So the third thing is infectious, and so infectious, that makes more sense. That's pretty much like salmonella, viral things, E. coli, all different kinds of bacterial exposures that are on there. So really the ways that, you know, with meat, yeah, kind of rinse it off, but also we're going to cook it, so that's going to kill a lot of that stuff. Vegetables, well, you know, because not everyone cooks all their vegetables. If you're cooking them, well, that's going to be safe for the infectious, but you still want to get the physical and the chemical off. So you're going to have to, you know, rinse them, even though, you know, we don't seem like you should have to wash some of that stuff, but you probably ought to these days just to make sure.
Yeah.
Somebody touched it at some point.
Someone touched it, and
Yeah.
probably their hands weren't clean.
Probably not.
Go.
Yeah.
So,
I don't
anyway.
want to know about that.
So I did want to talk more about those VOCs because I did have a couple things that I just want to bring up. So those volatile organic compounds that we're exposed to in our house. So the things that they can cause eye irritation, ear, nose. They can cause headaches, and in high doses they can cause liver damage and kidney damage and CNS damage. So they go from mild stuff to extreme.
What's
you know?
CNS damage?
Seizures,
Central nervous system.
producing all kinds of nerve problems. You know, I mean, who knows? Maybe that may lead to Parkinson's and all these other kinds of
geez.
things. So on small levels, really, we are all exposed to this stuff. So it's really, think about this. You know, common things: perfume, hairspray, dry cleaning, air fresheners, cleaning products, cigarette smoke, gas, things like that. Wood, burning wood does. And so, you know, these things, you know, there's really no way to get away from all of it, but you want to limit it. Maybe when you're having some of this stuff around, try to increase your ventilation for those things. That's where the HEPA filters come in, so that you're limiting that. And I can tell you the HEPA filters work because we have them in all the bedrooms, and when I change them, they are disgusting how dirty they are and how much stuff has been in the air and has been trapped. It's weird. I mean, it's just weird how much stuff is in them. But anyway.
Are these individual units?
Yes. So we have one in each bedroom. And I mean, you should have one where you're going to primarily spend most of your time. You know, if someone spent a lot of time in their family room, they probably ought to have one in there as well. And they don't have to be big. They're not expensive, you know, but
How often do you clean them? Like monthly?
Well, they actually now, I mean, the ones have sensors when their filters are starting to sense obstruction, so they tell you when you have to change them. Some of them come with reusable filters that you can wash and put back in there. Some of them are disposable. So
Interesting.
Is there any scale? Say 1 per every 1,000 foot. Of house,
they'll
or
tell you.
something like
They
that?
will tell
Oh,
you.
from
And
the
so
manufacturer.
I think what I really think at the minimum, if someone was going to do one, like I think that you should have one for your son's room and one for your bedroom, and that's at the minimum. Because guess what? That's where you spend most of your time at night, in that air. You know, just breathing that, whatever that air is. And so that's when you're going to wake up and have more exposures. When you're out and about, well, it's a little bit harder to have anything, but at least you can at least control that one segment. And so those they're not much money. I mean, maybe $50 or something for these filters. And, you know, they also provide some air circulation, so it kind of adds a little bit of coolness to the room and stuff like that.
Never thought about
There are
that.
some very sophisticated ones that will really do really very small filtrations, you know, I mean, because they use them in, you know, in labs and stuff, but I don't think that, you know, most person probably need that. But
So anyone who has allergies,
which is almost everyone in Florida.
Yeah.
Trying to say everyone has allergies.
Oh, yeah.
you should have one of these
And
filters.
if you're not having true allergies from things, what people are doing is why this is important is you're developing allergies to these sensitivities to these things. So these VOCs are probably irritating your airways. Now you're getting sensitized to all this other stuff. And so what happens is it becomes a progressive problem where, you know, you may have not been born with allergies. Oh, I'm good. I don't have anything. But by the time you're an adult, you're constantly having runny nose. You're constantly having a sore throat. Constantly always blah, 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 and it causes fatigue. It causes a lot of stuff and a lot of symptoms. And you know, we're just not aware of it. I mean, when you think about it, stuff that's airborne, you know, and when you inhale that, that's going 100% into your system. You know, I used to be an anesthesiologist, so we gave people gas to put them to sleep. Within 2 breaths, they were asleep. So it is going right in. So think about the stuff that we are not, you know, yeah, you might not smell some of it, but, you know, it's there. And so there was another thing with the cleaning products. You know, people that use high amounts of Clorox and some of these cleaning products, when you can smell that at a level, it's about equivalent to the damage that you would get from smoking 20 cigarettes.
What? Wait. Say that again?
Clorox, bleach.
So when you smell
bleaching,
that,
when you're bleaching and you've been exposed to that,
and you smelt it, you
and you're
just
cleaning, and
had
you're
the
still
equivalent
cleaning.
of 20 cigarettes.
Yeah.
Good thing I don't clean.
Yeah.
I'm safe.
Yeah. You are very safe.
See, that's why I don't. I am
You're
trying to
yourself.
protect
But the rest of
myself.
us, we can all die from a dirty, filthy house.
Yeah.
But anyway.
Yeah.
Yeah. So it's. But anyway, these things all, you know, there's a good and bad with all of
My
them.
wife
so-
isn't watching this.
Yeah.
Put the bleach down, ladies.
Yes.
In smaller
You
amounts.
heard it from the doctor.
You don't know. You can use it.
Doctor ordered,
Dilute
do
it
not
way,
clean.
way down. No, I did
You
not say
will
clean.
be injured.
It's don't have to put it pure on there, which is what most people do. It's
Like
the
a 10 to, like a 10 to 1?
Yeah,
or-
it's the old adage.
Now he's retracting the
No, I'm
statement.
not retracting. I'm saying that, but people just pour it straight,
Yeah.
and use it straight,
I'm just going to be on the safe side
and not clean.
and
Never
not
use bleach
clean.
and lime away. I know that.
Yeah.
For a fact.
Whatever.
Yeah. So, got any other interesting topics you wanted to bring up today?
I think I brought them all up.
Good. So, Recharge Clinic is having an open house August 25th, which is a Saturday from 10 to 2.
2 days before my birthday.
Oh my gosh, good thing you said that.
Why? Because you would have forgotten.
No.
Yeah.
Literally.
Don't worry, I'll continuously remind you since this is my birthday month.
Please do. I've been busy.
Yeah, exactly.
James, why didn't you remind me?
I was waiting.
His birthday is August 27th. See, I know. 2 days before that, we're having an open house at Recharge.
Pre-celebratory open house.
Yeah, it's going to be lots of specials, fun. Of course, we'll have food. And that'll also be your birthday party. See, I did that on purpose. So bring Dr. Tieche a birthday gift that day. Or some food, because he loves food.
No, I am on a diet.
Oh,
Don't
he
bring
is.
me any food.
He's trying hard.
I have been, yes. I
Bring
don't need
him some meat.
I don't need temptation.
Bring him a protein cake.
Ew, that sounds disgusting.
I'm sure someone can make a good protein cake.
I'm sure they can.
A meat cake.
Unless I go completely off my diet that day, and then you bring me
a
whatever.
beefcake.
Beefcake. That's
Yeah.
what I've been called that already.
You've been called
I'm a
beefcake?
beefcake
You are a
already.
beefcake?
Yeah.
Flex your muscles.
I've noticed that. Yeah, I can
Look
tell.
at it. Look at his little guns
I can
over
tell. I
there.
know.
I'm packing heat here.
Packing.
I am packing heat.
You have a concealed weapons permit for that?
Yeah, these are exposed though. They're not concealed.
Sun's not out, so the
Yeah,
game's
sun's not out. Yeah.
Oh boy.
Anyway, don't embarrass me.
We love it. All right, so come see us. Check out our website, rechargeocaliclinic.com. James, thanks for coming today.
My
Thank
pleasure.
you.
My pleasure.
My
Thank you. Come again.
Oh my gosh, we better get off the air.